Hi, I'm Dr. Meredith Sweeney with Sino Longevity, and today we're going to talk about continuous glucose monitors. So I want to start with the fact that there are many on the market, and more of them are becoming available for you to buy without a prescription, which is incredible, and it makes it available to those of us who are not diagnosed with diabetes and want to pay out of pocket for these devices. A CGM, as you will hear it called, is a way of measuring your blood glucose continuously. And it connects to your phone, or you can have a little tracker device too, but almost everyone's going to connect it to their phone at this point. And it'll give you real-time glucose measurements, even while you're asleep. And this is useful for a bunch of different reasons. It's useful for your tracking your metabolic health, for seeing how well or how poorly your body responds to things like, of course, food. But also it's going to give you insights into how your stress and your sleep and your exercise affect your glucose levels. And why do we care about our glucose levels? Because this is a marker of your metabolic health, and that is how well your body turns the energy that you put into it, the fuel, essentially your food, your air that you put into your body. How well does it turn that into usable energy for you to perform daily functions, for you to move, for your heart to beat, for your lungs to breathe? Your metabolism is just a fancy word for energy production. Your metabolism and your metabolic health is also a really good measure of your longevity, your health span. Health span and lifespan differ from each other in that lifespan is the amount of years that you're going to live. Health span is referring more to the number of healthy years that you're going to have in your life. So most people want to live longer, but most people want to live longer and enjoy those years. They want to enjoy their health during those years. So that's what we mean when we talk about your health span. And that's what I work with patients on, is elongating their health span, elongating the number of years you get to live a productive, enjoyable life. So back to the CGM. I'm going to put one on today so that you all can see how easy this is. So I already pulled the label off of this, and I've tried 3 different brands at this point. I will do a comparison at some point. This is the first time I'm trying this particular brand, so I don't have enough information on its usability yet to be able to give you an accurate or a useful kind of rundown of my experience with it. So you have the applicator, and then you're going to unscrew, and almost all of them work this same way. So I'm going to unscrew this cap. I'm going to line up these 2 devices. Now the actual CGM is in here. There is a small needle in there that's going to insert the device into your arm, but then that needle retracts. It's not left in your arm. That's a common misconception. So I snapped the 2 pieces together. Now, what's left in here is the CGM with that small needle. I'm going to choose a spot on my upper back arm. Every CGM I've ever seen recommends that you use the back of your arm for inserting this device. They last for 2 weeks on average. So this is not painful. I've already cleaned the back of my right arm here. And you're going to choose like the fattiest part of your arm, and then you're going to deploy the device. So that's it. I just put on that CGM. That's going to stay there for 2 weeks. The first night, realistically, if I sleep on that side, I'm going to feel it a little bit. It's not painful, but it's slightly uncomfortable. So if you sleep on that side, if you always sleep on one side and you're a sensitive sleeper, maybe put it on the other arm. Most companies also recommend that you switch arms every 2 weeks when you put on a new device. When it does come time to remove that, this is very sticky. It sticks very well. It's going to take a little bit of effort to peel that off. It's like a very strong Band-Aid. A lot of 2 of the brands that I've tried so far did come with patches that you put over this. This particular brand, which is Lingo, does not come with a patch. So they obviously don't feel like you need it. So let's get back into the science of continuous glucose monitoring and why you should consider using one of these. And I ask every one of my patients to use one for at least a month. For 2 weeks, I'll ask them to not change a thing and just look at the insights that they're going to get. They're going to see how their breakfast affects them, how their lunch affects them. Do they see big swings in their glucose variability? Which can be a problem. So we're going to teach them how to minimize those glucose spikes, as we call them. What time of day that might affect the spike that you have in your glucose, or what we call your glucose variability. If you're fasting, meaning not eating for prolonged periods of time, you'll see what your sugar does during that period. For example, I wore a CGM this year during the mini marathon, and I ran complete in a fasted state. I only had coffee that morning, and my blood sugar remained in the 80s, 90s, low 100s at some point during that mini marathon. So your body is very good at making its own sugar. You don't have to put it inside in your body. Your body has a process called gluconeogenesis where it can make its own sugar to be used. And it can also use ketones. That's a whole nother video that I need to record on using glucose versus ketones for energy. So the continuous glucose monitor, it gives you that information about what your sugars are doing. And like I said before, your sleep, if you get poor sleep, you're more likely to have blood glucose variability. You're also more likely to experience hunger and cravings with poor sleep. Stress does the same thing. Blood sugar spikes are a surrogate marker for insulin release. So for my patients that are looking to lose weight, the name of the game is minimizing your insulin. And we don't have one of these markers for insulin. We only have it for glucose. But the good news is that glucose is a surrogate marker for insulin. And the reason for that is when you ingest glucose, this is in the form of starches, sugars, carbohydrates, your body breaks those down to simple sugars. That sugar is released into your bloodstream, and that's what you see in this monitor. When your sugar is released into your bloodstream, your body tells your pancreas to release insulin. That insulin that takes that sugar out of the bloodstream and gets that sugar to a safe storage spot. Now, if you are going for a walk, it's going to use that sugar right away. If you are an athlete and you did a lot of muscle work that day, it's going to use up that sugar, or it's going to use it up later in the muscle. But that sugar needs to go somewhere. It can't just be circulated in your blood, and that is the job of insulin. So insulin, you could think of it as a fat storage hormone. This is what I tell my patients. You want to minimize your insulin release because it puts your body into a fat storage mode. And most of us want to be in a fat burning mode, especially people that want to lose those extra pounds and lose them safely. You want to lose fat mass. You don't want to lose muscle mass. If you want to lose weight, you want to minimize your insulin secretion, which means you want to minimize your glucose spikes. So that's how that all feeds together. So in terms of weight loss, that's how this thing helps you learn more about your body and how specific foods affect you. What affects one person one way, let's say eating a piece of chocolate cake, one person might have a huge spike in their blood glucose. Another person, it might be minimal. And we're going to teach you ways that you can minimize those blood sugar spikes. Besides just avoiding the chocolate cake to begin with, there are things that you can do, techniques, tricks that you can employ to help lower your blood glucose spikes. So we'll do a video on that as well. My specialty, my passion is around longevity medicine. And here's where this device and monitoring your glucose and learning about your body can help with longevity. A lot of the diseases that tend to come along with aging, heart disease, diabetes, obesity, high blood pressure, high cholesterol, dementia, Alzheimer's, these things happen as we get older, and these are the things that we are trying to stave off. And a lot of them have to do with our bodies being in chronically inflamed states, and a lot of that inflammation has to do with our diets and with sugar spikes. So stable blood sugar, as measured by your CGM, can help you determine how well you're doing from a longevity standpoint. How you're treating your body now is how it's going to treat you in the future. So minimizing blood sugar spikes is one of the best things that you can do for your health span to prevent those other diseases from coming on and to prevent overall body inflammation. If you've listened to any of the longevity specialists out there, you may have heard the term inflammaging before, because inflammation is really a hallmark of the aging processes. And this is what I get for doing my first YouTube video because my screen went away. Stand by. We're back. So inflammaging, that is the description of inflammation in your body, which is a definitely a marker of how some of these other diseases develop. So you want to minimize the inflammation in your body, and that's going to promote a longer, healthier life. So CGMs, definitely worth their weight in gold as far as I'm concerned. I ask all of my patients to use one for at least a month, 2 weeks not changing anything, and then 2 weeks changing up their food, changing up their eating style, changing up their habits to see how they can minimize those blood sugar spikes. So I will follow this up with a video comparing the few different CGMs that I've tried so far and their software, their user interfaces, how helpful the information is, how they track it, and we'll let you know about that. We'll link to that in the comments below once that's filmed. So thanks for your time, and happy glucose measuring. And it's somewhere in there is where this number is going to catch up to that. So there is a bit of a lag from your blood glucose to your CGM because this is located and tracking, measuring your interstitial fluid. Another thing, if you sleep on this monitor like this, it's going to compress those tissues a little bit. You might notice some wonky measurements throughout the night because possibly that glucose is being pushed out of that interstitial fluid and your readings might be a little bit off. So if you notice a drop in the middle of the night that looks like you should be worried about your health and how did I wake up this morning, it may just be that was compressed and that's what you're seeing. You will see swings in your blood glucose throughout the day that don't seem to be related to meals, and that is normal. The most common one that you're going to see and almost everyone is going to have is called the dawn effect. When you wake up, you're going to notice your sugars rise a slight bit, and that is because that's your body's natural way of getting ready for the day. It uses that glucose for energy, and what does it need as soon as you wake up? You need energy.